This is episode 3 of How It Rocked My World. And just to get you up to speed, what I talked about in the previous episodes was about my experience having very painful and heavy periods. Since I started my period and throughout high school, I went to my first gynecology appointment and I told her I was having a lot of pain. She offered me birth control. I declined it and that was it, and that was really disappointing to me. So I just left that visit and kept on going the way things were, everything getting more painful and more heavy until about 5 or 6 years later, I experienced a stabbing sharp pain in my left ovary area. And I changed gynecologists. She did an ultrasound. I finally got pretty much diagnosed with endometriosis. That cyst that she found was about 4.5 centimeters large. And just to give you an idea, I have my handy dandy ruler. 4.5 centimeters large is about, let's see, that big. From here to here is about 4.5 centimeters, just to give you an idea of how big that cyst was on my ovary that led her to believe that I had endometriosis. So I scheduled surgery with her, and she kind of gave me an idea of what to anticipate. I asked her if this would relieve my pain, because that was like the biggest thing. And honestly, I was kind of relieved to get this diagnosis. I know that sounds funny, but I mean, we're talking, let's see, 12 plus years of having these symptoms, and a lot of people not understanding or not buying it or thinking I'm crazy. I really felt crazy. It's like, does this really exist? And this was confirmation that I wasn't crazy. And she made me feel a lot better about that, actually. That's what she told me. She said, you're not crazy. You have a disease that causes a lot of pain. So it was great to finally put a name to it and put a finger on it, what it actually was. Although it was disappointing that it took so long to get that diagnosis, and I will get to that a little bit later, why we don't have to have that experience. But anyway, so scheduled surgery. She said it should relieve my pain. I was so happy to hear that. But she also said that there could be some microscopic lesions that she doesn't see, in which case she would not be able to remove that, in which case it would get worse. So she warned me of that ahead of time, which I thought was a little strange, just that was the case in general. And but I was still like kind of like a deer in headlights at that day. I just went with it because it's not like I could decline the surgery at that point. So here was the other part of the plan. The first part of the plan was schedule surgery. The second part, like I discussed last time, was you need to get on birth control right now. At the end of last video, I talked about how I did take the free samples that she gave me home, but then I started to do some research and I ended up not ever taking them. And I'm grateful for that. Okay, so I'm gonna explain a little bit of this to you. I'm not a medical professional in this way. I've just done a lot of my own research. I've talked to a lot of different people, including physicians and Creighton practitioners as well. And I've come to these conclusions. So I'm gonna share them with you, but I do encourage you to do your own research and come to your own conclusions. I'm just gonna share with you the things that I have found that I think are very interesting and worth giving some thought to. The doctor tells me that the goal of birth control is to preserve your fertility until you're ready to have children and to relieve pain. So that's what I want to look a little bit deeper into. First, let's look into how birth control works. According to WebMD, birth control hormones, this includes the patch, pills, or the ring, stop monthly ovulation and the growth, shedding, and bleeding that makes endometriosis painful. Birth control hormones improve endometriosis pain for most women. Our local naprotechnology doctor has told me that there's no research to indicate that it prevents the disease from growing. What it is just masking those symptoms, taking away the pain that you're feeling that's associated with the disease. So, according to WebMD, this says that birth control hormones stop the growth that makes it painful. I've heard it both ways. I think at the end of the day, it kind of comes down to, are you willing to take that chance? And I'm going to talk a little bit more about birth control and its effects and other things that are harmful potentially to the body. So I think it's just weighing pros and cons at this point. However, whether or not it does stop the growth of endometriosis, I personally don't believe that it does. I believe my napro doctor, but even if it does stop the growth of it, and it does stop the symptoms, there's already damage that has occurred. Does that make sense? So whatever's happened in the past up until the time you start taking birth control, regardless of what happens after it, it's not curing anything. It's definitely not healing anything or repairing anything. It's just stopping your ovulation and the stuff that makes it painful. Okay, so the damage is there. The damage has been done at the point where you start taking the birth control, and that is the fact. This is why it's often referred to as a Band-Aid. We call it the birth control Band-Aid, the cover-up. It's just putting a Band-Aid on those female bobos. It's not fixing or curing anything. So the hormonal treatment works only as long as it is taken and is recommended by most gynecologists for women without severe pain or symptoms. So the question next is, what happens later on when you get off of the birth control? You know, we talked about it preserving fertility for a certain amount of time until you're ready to have babies. But again, it's not fixing anything that's damaged. So what happens when you get off later on of the birth control? According to the Mayo Clinic, hormone therapy is not a permanent fix for endometriosis. You could experience a return of your symptoms after stopping treatment. So, according to this treatment plan, take birth control up until surgery, have surgery, get back on birth control, or stay on birth control until you're ready to have children. Get off of the birth control because you're ready to have children. Well, the problem's still there. The problem still exists. If you don't have surgery, it for sure still exists. So why not look for a better solution? That's my question. This birth control plan, if there's something better, then this birth control plan is not good enough for me. It kind of feels like it's this one-size-fits-all treatment plan, which is interesting because I am so different from every other woman. You know, we're so unique. I'm so different even from my own sister and from my own mother. Why would the same treatment plan, same pill, or whatever version of birth control, why just offering that for no matter what our symptoms are, why is that the best thing just for anyone across the board? In the 1970s, that's when the Creighton model and NEPR technology started to become developed by Dr. Thomas Hilgers and his research in response to the creation of artificial reproductive technologies like the pill. And it was given other women an option if they didn't want to take the pill. This is good for us because it kept the research going. But in mainstream gynecology, when birth control was introduced, that seemed like just this great plan that would just work across the board for everybody. They stopped researching the woman's body. That was it. But Dr. Hilgers continued to research, and he continued to learn about the woman's body so we can understand how it worked better and treat it cooperatively with the body. And it ends up being a better treatment plan overall than birth control. But I'm gonna get more into that in a little bit. I just wanted to unpack this a little bit to get you to think about the whole idea of birth control and handing it out so freely. Now, if you're on birth control and you love it, you know, you're not having bad side effects, and that's your choice, then that is great. But the reason I'm sharing this with you is because it didn't work for me. I wanted something different. I wanted more options, something that was more holistic, more natural, that cooperated with my body, and I found it. But I find a lot of people don't know about it. So this is just to share this with you. So I went into my pre-op before my very first surgery. I went in with my mom, and the doctor explained how everything would be, how it would go down, etc. Something I found to be really interesting, she read to me these papers. I signed a bunch of papers, and she explained to me that if once she got in there and she felt like the damage was too bad in any part of my insides, she was asking me to sign a paper giving her the right to take out one or both of my ovaries, tubes, uterus, and that's everything. All my whole fertility, just like that. And that was really scary to hear. And I didn't know any better at the time, and I signed the paper. And I just remember feeling so helpless because now I'm literally putting my fertility in her hands. And I know she cared about me, and she told me I'm gonna try my very best to keep everything. But ultimately, when I'm in surgery, knocked out, I gave her the permission to potentially take out everything that gave me the ability to have children. It's very interesting because not all doctors have you do that. Again, something else I'll get to later. I went into this surgery, took about an hour and a half, which I believe is pretty standard for this type of surgery. And thank God I kept all my organs. She said she almost removed one of my ovaries, but she decided not to. And that was it, my first surgery ever. It was scary, but it needed to be done. And I was so hopeful, finally, after so many years, to have relief. I told you again, now most people are on birth control at this point. I was not on birth control, I declined it. I assumed that the surgery would fix the problem because again, that is our goal in healthcare, to have our problems treated. Unfortunately, nothing changed at all. The pain, exactly the same. The bleeding, exactly the same. I didn't get an ounce even of relief. It was so disappointing. So 3 months later, I went in for a post-op ultrasound to see what was going on. By the way, in the surgery, she removed that 4.5 centimeter cyst. That was gone at the time of surgery. This post-op ultrasound revealed that now I had a 6 centimeter cyst. Show you about a 6 centimeter cyst. That is a bit bigger, about that big, that's 6 centimeters. And I had a new one. I had another one. So within 3 months, either the endometriosis was not taken care of and removed, or it was removed in a way that was not productive and it came back very soon and got even worse. So I want to challenge you with another question to ponder. It is my understanding that birth control does not necessarily stop the growth of endometriosis. It just covers up the symptoms so that we don't feel the pain. For most of us, it doesn't work like that for everyone. So, had I taken birth control, like most people do, I believe most people do stay on the birth control during surgery, how would I have known that the endometriosis was not fixed surgically? It was not treated well during surgery. I would not have known that if I wasn't having the symptoms. I don't think. It's just something to think about. Because I was not on birth control, I was aware that it got worse in a very short amount of time. So at that post-op ultrasound 3 months after surgery, she told me I need another surgery already, that soon. Now, being so aggressive as she was in the first one, almost removing an ovary but keeping it in, how aggressive do you think she's gonna be in that next surgery? So this is obviously going through my mind, scheduling a second surgery with the same person who nearly removed an ovary and obviously didn't get rid of the disease well enough. I'm not feeling very confident going into this next surgery. I start to ask questions like, does she really know how to treat this disease? Because all her other patients are, I shouldn't say all, but most of her other patients, they're on birth control. And so I think it's a little bit different. You have to start questioning, my fertility was and is so important to me. Having babies, like I mentioned before, it was never a dream because I just assumed it would happen one day. I didn't have to dream it, it just was. I mean, that's how we think about it when we're young. This was too important to me to sacrifice this early in my life before I'd even been able to think about having children. So I was not settling there. I'm still not settling, I went and I did some more research. I learned about other doctors and what they learn in med school and the underlying issues we have with diseases and treatment plans. So anyway, stick around with me. I'm gonna get into all of this and a better solution for you and treatment plans for you and anyone you know that has these issues. So stick around and I'll talk to y'all soon with some more of the story. Subscribe and follow me on YouTube, Facebook, and Instagram. You can also reach me at takingbacktheterms@gmail.com. Share this video and other videos to people that you know that you want to help with any type of women's issues. Let's try to get this information out there.